Hi, everyone. Welcome to our May office hours. We're just going to go ahead and wait a second, just make sure everything is working okay, and we will go ahead and get started. All right. Everything seems to be working good. We're streaming live. Let's go ahead and get started. So my name is Alex. In case you guys didn't know, I am the Director of Marketing here at Paloma Health. Those of you who are just joining us for the first time for our office hours and maybe don't know who we are, at Paloma Health, we are an online medical practice that specializes in and treats both hypothyroidism and Hashimoto's. What is really great about us, like I said, we're an online medical practice, so everything is done virtually, meaning that you can see your providers, get labs, all done from the comfort of your own home. But we also have our at-home test kit, which you can order online, get sent to you, and be done at home as well. One of the things, though, our providers obviously can order labs as needed. So if you need to go to, a blood draw area to get some labs done, you can absolutely do that, and our providers can do that. We do medication management, everything to help support your thyroid health. Essentially, we have blogs, resources, all on our websites. I will say Mary is a big, huge contributor to all of that. So a lot of the research that you see on our blogs, that is all kudos to Mary, our senior editor here. And we also have a free mobile app that you can download on iOS and Android, and you can symptom track. Again, plenty of resources, exercises, meditations, you name it, we got it on our app. So without further ado, I'm going to go ahead and jump off, and I will, pass the torch to Mary, and she will be our special guest for today and today's office hours.
Thanks, Alex. I'm thrilled to be here. Love to do office hours. And it's always really fun for me because as a patient educator and a patient advocate, I approach things a little differently than the doctors do. And I'm always sort of looking at it from the perspective of a patient, trying to figure out how to go forward, move up the learning curve, and get to the information and the right people and the right ideas that are going to help you live well, feel well, and really enjoy better quality of life. So I'm very excited. We're going to be talking about the questions that you folks are having. So I see the first question coming in is, since my diagnosis with hypothyroidism, not Hashimoto's, in 2022, I've gained 15 pounds. I take Tirosint and T3. I've been T3 only before, and I've been Tirosint only before. I feel best on both together. My energy is fine. It doesn't matter what I do. I cannot get this weight off, and it's driving me crazy. This was never a problem before. I don't want to buy new clothes, and everything is tight. I've read that calorie restriction is not good for people with hypothyroidism, so I don't know what to do. Any suggestions? Well, the first question that I would have is to find out where your thyroid numbers are and whether they're optimal. Because in many cases, when we're treated for hypothyroidism, doctors are treating us into the reference range, and that is a broad range. And metabolically, we are not optimally replaced. Our thyroid hormone replacement is not at an optimal level unless our TSH is in the lower end of the reference range, and our free T3 and free T4 levels are in the upper end of the reference range, usually about the midpoint to higher of the reference range for those two active thyroid hormones, T4, T3, and in particular, that T3 or free T3 level is going to be especially crucial. We also want to look at blood sugar, because high blood sugar, which causes insulin resistance, can also make it more difficult to lose weight, and it's much more common in people with hypothyroidism. I also don't have an age on the person writing in, but the other factor that could be playing a role here would be perimenopause or menopause. Perimenopause can start in your late 30s, and it's the fluctuations of estrogen and progesterone that can affect your body's ability to hang on very, very effectively to every calorie you take on. So what I would suggest would be to dive a little bit deeper, look at those thyroid numbers, determine if they are in fact optimal and not just in the normal range. Take a look at that blood sugar level, see what's going on there. and take a look at whether or not perimenopause may be playing a role. These are only a few of the very, very many factors. We have lots of articles and speaker series events and podcast episodes about weight loss for hypothyroid patients. So I would also suggest that you do some reading over there as well. Okay, let's see. Next question. Looks like that's the same question that was repeated, Alex. Do we have a different question? Here we go. I'd like to hear about Ozempic for people with hypothyroidism. I'm on Ozempic for weight loss. I have none of the other issues it's intended to treat, which Ozempic is intended to treat type 2 diabetes or insulin resistance, high blood sugar. It's helping with weight loss, but I'm hoping that I won't need to continue on it forever if I can get my thyroid properly treated. Obviously, a conversation I need to have with my doctor, and I will, but I'm curious to know more about whether and how semaglutides are often part of treating weight gain from hypothyroidism. Well, the semaglutides, the Ozempic drugs, GLP-1 drugs are obviously very hot right now. A lot of folks are taking them. And it's not just people with thyroid problems. People are taking them for weight loss pretty much across the board. And even people that don't have a lot of weight to lose, 5, 10, 15 pounds. Every celebrity, it seems, is telling us now, oh, I'm on Ozempic, I'm on Ozempic. So the question here is, do you need to be on it forever? I don't know that we know the answer. I have seen some studies that have shown that after people go off of Ozempic, they sometimes do have rebound weight gain. But they're also looking, and there's new developments coming all the time with these GLP-1 drugs, where they may be able to come up with some that are going to have more lasting effects on the body, or that are actually going to retrain certain elements of this. The bottom line is, if you have a thyroid problem and it's contributing to a slowed down metabolism, there are some things that you can do. You can increase your muscle mass, you can increase some of your activity to increase your energy expenditure. But if it's gotten to the point where it has affected your metabolism to some extent, it may never completely revert to the way you were before your thyroid went haywire. I mean, I was one of those people when I was younger, I could eat anything, never gained a pound. After my thyroid, I gained a lot of weight. I was able to get most of that weight off, but my metabolism has never been the same, even though I'm optimally treated for hypothyroidism. So once you get your thyroid sorted out, will you be able to maintain the weight loss or continue losing weight? There's really no way I can answer that question. It's really going to have to be a trial and error process. But keep in mind, the more optimized your thyroid is, the more you've incorporated other lifestyle approaches, eating a very clean diet, anti-inflammatory diet, supporting with lifestyle, activity, sleep, you're going to be able to see the best possible results, whether you're doing diet and exercise or Ozempic or all of the above. Okay, how does HRT, estradiol, and progesterone impact the absorption of thyroid medication, specifically Levoxyl and liothyronine? Okay, Levoxyl is a synthetic levothyroxine drug, a T4 drug. Liothyronine is the generic name for T3 synthetic. Brand name would be Cytomel. So this person's taking Cytomel and Levoxyl, but is looking at whether HRT is going to affect the absorption of the thyroid medicine. The issue here is how you're taking the thyroid medicine, taking the HRT. If you're taking oral HRT, so you're taking oral estrogen, oral forms of estradiol, or oral forms of progesterone like Prometrium, it can have an impact on your, excuse me, I'm burping here from my lunch. It can have an effect on your thyroid levels, and you may need a little bit more thyroid hormone in order to accommodate the fact that the estrogen can have an effect on your thyroid levels. It's mostly the estrogen. The progesterone doesn't typically affect the thyroid to a large extent. It's going to be more the estrogen. If you're using a bioidentical estradiol patch or a cream, and if you're using progesterone creams, there's less likelihood that it's going to have an effect on your thyroid medication, because that bypasses the liver for metabolism purposes. So the key thing at Paloma we recommend is anytime you start or stop an HRT drug and you're already on thyroid medicine, get your thyroid levels rechecked 3 to 6 weeks after you have stopped or started to evaluate whether or not you need to adjust your thyroid dosage. And again, as Alex mentioned at the beginning of the program, the home test kit that Paloma has makes it super easy. You can do it in about 5 minutes at home, mail your kit in, and within a couple of days, you'll have the results on your test. You don't have to go in for a blood draw, get the Band-Aids, wait in the office, etc. You can just do it right at home very easily and be able to stay on top of this. All right. Somebody is asking us, when should you add T3? Okay. T3 is the active thyroid hormone. So just to give you just the briefest recap, thyroid gland under normal circumstances produces both T4 and T3. T4 is the majority of the production of the gland. T3 is the minority. But T4 is useless to the body. The only thing T4 can do is be converted into T3. T3 is the active hormone. It's the hormone that goes to the cells, tissues, glands, and organs and delivers oxygen and energy. So sometimes we are looking at patients, thyroid patients with hypothyroidism, and they don't feel well on the standard conventional treatment, which is a T4 replacement drug like levothyroxine. And that's because they don't have enough T3, which you can detect using a thyroid test. When that's the situation, in some cases, they're not converting T4 over to T3 effectively. They're not manufacturing enough T3 out of a thyroid that's still intact to make a difference in terms of being able to deliver that at the active level. In some people, there's genetic polymorphisms that make it harder to convert T4 into T3. Some of us lack the nutritional cofactors to do that conversion. So the fact is, some of us need T3. So when should you add T3? When you have symptoms of hypothyroidism that are not resolved, and your doctor can illustrate that adding some T3 into your treatment is not going to over-medicate you. And again, not everyone does well with T3. T3 can be a bit overstimulating. So some people find that it's like taking 3 or 4 shots of espresso too quickly. So you need to go slow and test it out, see how you do on it. And obviously working with a doctor who knows how to safely prescribe and monitor a patient who's on a T4, T3 combination, synthetic or natural desiccated thyroid like Armour or NP thyroid, which has natural forms of T4 and T3 built into it. Okay. What can you tell us about adrenal fatigue and insulin resistance when it comes to hypothyroidism? Well, what I can tell you, first of all, is that you say adrenal fatigue, and in the conventional medical world, they're going to look at you like, right, what are you talking about? They don't believe that adrenal fatigue really exists. But in the integrative world of where we look more holistically at people, people do understand that you can have an adrenal fatigue. It's not an adrenal shutdown, which is a situation called Addison's disease, very serious adrenal disease. But it can indicate that we're sluggish. Our adrenals are not doing what they need to be doing in order to support the body's daily needs for energy and stress, handling the body's stressors throughout the day, throughout the week. So when we talk about adrenal fatigue, it's more common with hypothyroidism. And if you think about it, a retired doctor, Richard Shomon, always used an example that I thought was very appropriate. He called it the 3-legged stool. And the 3 legs of the stool are the adrenals, the thyroid, and the sex hormones. And if all 3 of those legs of the stool are not balanced, we can't sit on the stool. We're going to be toppling over. So when our adrenals are not strong, it makes it extremely difficult for our thyroid to get balanced, and it also spills over into our sex hormone balance as well. So really the goal with any sort of hormone balancing is to look at all of these hormones together. So adrenal fatigue is common in thyroid patients, and there are a variety of supplements and lifestyle changes that can be implemented in order to get the adrenals back on board. The most important thing is to get proper good quality sleep. We are now just learning, recent statistics and studies were just reported on, women need more sleep than men. You know, who knew? I think I probably instinctively knew that, but a typical adult woman needs about 9 hours, and some of us are getting by on 6, 5, 6, 7 hours, but we really do need about 9 hours of sleep a night on average. So getting enough quality sleep is going to be extremely important. Eating a clean diet, minimizing the sugar and toxins in our diet. All of these are going to help support our adrenals, and all of that helps support our thyroid and our sex hormones. It's a rising tide lifts all boats kind of situation. Insulin resistance is also more common in people with thyroid issues. Insulin resistance is when your body starts to pay less attention to blood sugar in the system and the insulin that's released to help clear the blood sugar out. And as the insulin is released, the body says, oh, I'm not going to pay much attention to it, which then allows higher and higher blood sugars to be circulating in our bloodstream. This puts us at risk of type 2 diabetes, of metabolic syndrome, increased belly fat, and it then ultimately over time increases our risk of heart disease as well. So insulin resistance is something we want to pay a lot of attention to. If you're not already, you should be getting a hemoglobin A1C test, which tests your average blood sugar over 3 months or so, and paying attention to that number, because as it starts to creep up, that is a sign that you may be becoming more and more insulin resistant. So there's a lot of different approaches, more than we can get into in our office hours today, on how to combat insulin resistance. We have a number of articles, and we have some speaker series events that talk about insulin resistance at the Paloma website and the Paloma blog and podcast. But I guess what my point is, if you're hypothyroid, pay attention to your adrenal health and pay attention to insulin resistance and your blood sugar levels, because they are more likely than the average population to have some issues. So you want to stay on top of it and monitor it carefully. Okay, we have another question. When we take the Paloma thyroid blood test, is there a good time of day to do it? I think that the key thing with the Paloma blood test is that as a finger stick test, it is very fixed in terms of its reliability. If I go and get my blood taken at the local lab, they're going to take let's say I go at 7 in the morning, they take my blood, it sits on the counter, then they package it up, then they put it in, a doctor's office, then they put it in that little mailbox type of thing outside, it sits in the heat, then it gets picked up by a truck, who knows where it goes, it sits in the lab for a couple of hours. So the time of day that it's taken can have a tremendous impact, because of it's going to somewhat change during the day in its whole blood form. And then, of course, it's going to be exposed to heat and other factors that can degrade the sample over time and give me what could be an inaccurate TSH result or other thyroid levels that are being checked on the blood test. The benefit of the finger stick test, and for those of you who are not familiar with the Paloma test, you're using a little tiny lancet, much like when people check their blood, their blood sugar. You're using a little tiny lancet to prick. You're taking drops of blood and putting them on this little card that's specially treated. Then you're folding it up after it dries in a couple of minutes, and then you're putting it in the mail. Once that blood hits that card, it doesn't degrade. The sample is intact. So it can go through the mail, it can go to the lab. It doesn't matter if they look at it that moment or 5 minutes later or whatever, it's going to be an intact and accurate blood sample. As far as the time of day is concerned, the one thing that I always tell people, whether you're getting a home test or you're getting blood taken, is try to get tested on a regular basis under the same circumstances. So if you usually do your Paloma home test in the morning, keep doing it in the morning. If you go to your lab to get a blood draw in the afternoon, keep getting it in the afternoon, because when you change times of day, you may be introducing an additional factor that adds some differences to the results that are not going to necessarily give us accurate information. Okay, so how should Hashimoto's patients approach iodine supplementation? I've heard so many contradictory things about iodine. For example, it's important for thyroid health versus it fans the flames of the autoimmune response. If we are eating a lot of cruciferous vegetables, is it a good idea to take a little iodine at the same time? Okay, so iodine supplementation is definitely it's a hot button, and it's a controversial issue. We have some doctors out there who think that every thyroid patient needs to be on high dose iodine. We have other doctors, chiropractors like Dr. Karazian, who believe that everybody who takes iodine is going to flare up their thyroid worse. I think at Paloma we take a more personalized approach and a more middle of the road approach on this, which is if you are in an area of iodine deficiency, you live in the goiter belt in the Midwest, for example, or you've cut out all iodized food, salt, processed foods, etc., from your diet, it's worth having your iodine level checked to see if you're deficient. The majority of Americans are not deficient, but the number of people who are deficient in iodine is starting to grow. We're seeing it at about 20-25%. So you can get your iodine level checked to see if you need iodine supplementation. And I think we would recommend that you do that before you add anything more than the recommended daily allowance of iodine. Now, of course, if you're pregnant, you definitely need to be taking some iodine, but typically they're going to include that iodine in your prenatal vitamin. So you don't need huge quantities of iodine, large bottles of Lugol's solution or iodoral or iodine supplements. It's going to be built into your prenatal, but make sure, because not every prenatal has that iodine in it. So we want to take a look at that. And if you need iodine, if your test shows that you have very low iodine levels and you need iodine, you can take iodine, but be very careful and go very low and slow, because when you get to higher levels of iodine, it can in fact aggravate autoimmune Hashimoto's. So we want to be super careful about that. Now, there are situations where people have mild hypothyroidism. They don't have necessarily Hashimoto's, and they're slightly deficient in iodine, where low level or medium level iodine supplementation may actually be enough to nudge their levels back into the reference range and relieve their symptoms. And for those people, more power to you. It's great because you actually can manage your situation with iodine. But that's not the case for the majority of people. So go low, go slow, and test before you start taking iodine. I'm a perfect example of this. Early in my journey with my Hashimoto's, everybody I talked to said, you got to put iodine, you got to take iodine. So I started taking high doses of iodine, and immediately I had a Hashimoto's flare. My thyroid got all inflamed and enlarged. I felt exhausted. Within 2 days, I was crashed on the couch, and I never have tolerated iodine. But there are times when I crave iodine. I feel it. I want sushi. I want some salt. I want some things that have iodine in it. So I get it from food, because the supplements just don't work for me and they don't agree with me. So listen to your body, but don't just go willy-nilly out there and start taking huge amounts of iodine. You can include it in a multivitamin or in a prenatal vitamin, but to go much higher than that, I really recommend you get tested first before you start supplementing with higher doses. Okay, is the keto diet dangerous for Hashimoto's patients? Well, I mean, I guess this would depend. There's no one size fits all answer, because it really depends on whether that Hashimoto's patient are they a type 1 diabetic? Do they have other nutritional deficiencies or issues that they need to be dealing with? So the question here is what is the patient's unique situation? But on the whole, no, the keto diet is not dangerous for Hashimoto's patients. It can be a very healthy diet. The key thing with any diet that is a formal diet, like, okay, the keto diet, the this diet, the that diet, is you want to make sure that that diet is very balanced. You want to make sure you're getting all those nutrients that you need. People that have gone on very low carb diets sometimes end up eating a lot of proteins, but they're not then getting all of these vitamins and minerals that they would be missing out because they've cut out fruit or they've cut out other vegetables, starchy vegetables, etc. So one of the things you can do if you're a Paloma member is work with one of our Paloma nutritionists who really know what it takes to get a balanced diet that will also help with maintaining weight loss or helping you stay at a healthy weight or to lose weight, but in a healthy way, because we don't want to cut out every food group in this category, that category, and go only with protein and no carbohydrates and no good fats, etc. We want to really look for balance and good health. And so that requires a certain amount of sort of strategic understanding of how it all works. That said, we have great information on so many different ways of eating. Check out our blog and check out some of our speaker series, because you can learn all about paleo and keto and the AIP, autoimmune protocol diet, and many other approaches to eating healthy. And one of them might be just the right approach for you. Have you heard more complaints towards Armour Thyroid? All my hypo symptoms have come back worse than ever these past few years. I've looked into it and people seem to complain about Armour all of a sudden not working for them around 2021, and their symptoms of weight gain, hair falling out, fatigue are restarting. This is an interesting question because it happens every couple of years. I think what happens with any of these drugs, and I'm not going to single out Armour specifically because it's happened with other natural thyroid drugs. It's happened with other levothyroxine drugs as well. But what has happened is that they reformulate, they put a different coating, they add a different filler, something changes, but they're not necessarily going to announce that to the public. Sometimes even changing where it's being manufactured, or in the case of natural thyroid, where is the porcine thyroid coming from, the raw material, the thyroid gland of the pigs, the dried, desiccated thyroid that they're using as the raw material. Where is it coming from? Sometimes some companies source in the United States, some in Europe. There's some that are sourcing in China. And are they changing suppliers? We have no way of knowing what formulations have maybe changed on these medications. But when we hear enough patients reporting the same things at the same time, and we've seen this back in the 2008, 2009 period, this was going on, mid 2010, 2015. So we hear it on a regular basis every couple of years. And what I suspect and what I've heard on the grapevine from other drug manufacturers is that they reformulated some things, but they're not going to announce it to the public. So is it possible that the Armour was reformulated? Certainly is. Do we know for sure? I have no way of knowing because that's not information that they make public. But what I do recommend is when you notice that you are having a significant return of symptoms, it may be time to try a different brand. There's several brands now of the natural thyroid. Besides Armour, there's NP Thyroid. There's another generic that's available on the market. And you may want to give at least a trial to another brand to see if maybe you're going to be able to absorb it better or have better symptom relief with it, or if something they've added to the one that you're not doing well on may be absent in a different formulation. Okay, so here's our last question. With Hashimoto's and hypothyroidism, can you experience periods that you feel actually like hyperthyroidism and then all of a sudden go there into a period of feeling hypo, flip-flopping every 4 to 6 months? Absolutely. This is, there's two different possibilities when this is happening. One of them is that somebody that's experiencing this could be one of the rare people that has both Hashimoto's and Graves. Because there are people, and I've talked with them, I've coached them, and I've heard doctors describe them as well. They have both Hashis and they have both Graves. So sometimes the Hashis is dominant, and so they're in a hypo mode. The thyroid is underactive. Other times the Graves is dominant, forcing the thyroid to pump out more hormone, and they get hyperthyroid. So that's a possibility in some cases. We also have people who have Hashimoto's thyroiditis who go through periods of hashitoxicosis, which is when the thyroid speeds up for short periods and pumps out a lot of thyroid hormone and then goes back into regular sort of slow down mode of Hashis and hypo. We see that a lot after pregnancy too. Women who are hypo or have Hashis during pregnancy, they deliver right after delivery. They may have a short period of hyperthyroidism, hashitoxicosis, where they get super hyper symptoms, and then it sort of calms back down again and restores itself back into the normal hypothyroid Hashimoto's mode. In some cases, you could also have what's called a toxic nodule, where you have a little thyroid nodule, but it is it is capable of all on its own producing thyroid hormone, and this little nodule starts pumping out hormone at erratic times, and so periodically you're going to feel hyperthyroid. You also may be looking at times when you're getting refills of your medication, because all the thyroid meds can vary somewhat in potency. So when you go to get a refill, if you're taking, for example, levothyroxine, and you are getting the generic levothyroxine, and you go to your pharmacy to get a refill for the next 3 months, they're going to give you a refill from any of the generic manufacturers, and that can vary from 90 to 110% of the stated potency. So you could have been taking a med that was at 91% potency. Now you've gotten a refill at night, and it's at 108% potency. It's like adding a bunch of extra pills every week. So we've had people report going hyper after they've gotten a refill of medication, simply because the medication potency was slightly different. So pay attention to all of those factors. If you notice that you're having shifts, you also want to take a look at our website, because we have some good information about Hashimoto's flares, because a flare-up of Hashi's can actually, even in some cases, cause you to have that thyroiditis, thyrotoxicosis, hyper period when you're in a flare-up, or when your immune system is under attack. You've come across a virus or an infection of some sort, and the immune system starts to go extremely haywire on you, and this can flare everything up and make you go into periods where your thyroid fluctuates. So I think that was our last question, Alex.
Yeah, guys, thank you so much for joining us. Mary, thank you so much for answering all those questions. As I mentioned, every time we try to get through as many questions as possible. Yeah. So if we didn't get through answer your question, we're going to have another event next month with Dr. Teresa Pena. She's one of our providers at Paloma Health. Great. She is absolutely fabulous. You will love her, and she will be joining us. And then we are actually having a nutrition edition in July with our registered dietitian, Nicole. And that will be really great. So you can ask any diet questions, food questions, anything as far as, more keto questions, XYZ, should I eat broccoli or not, whatever the case, it'll all happen there. So again, thank you so much for joining us. Please check out our website, so many blogs, resources, guides, as well as our mobile app that is completely free. If you want to try one of our test kits, go to our website, order that, become a Paloma member, and you can book an appointment. Honestly, we have some availability even as open as this week. So depending on your state and your provider. So thank you guys so much for joining. Really appreciate your time, and we will see you next time.